Welcome to today's episode of TheSquare. I'm Brandon Carmichael, and today we're actually looking at part one of two that's focused on design sprints. So today I have Eric Thomson, who is a project manager and a vice president in the healthcare sector in Phoenix. And so, Eric, why don't you tell me a little bit about why you are an architect?
Well, I started out, with a kind of a passion for drawing, and in some ways, I consider myself a Lego architect, or maybe a Brady Bunch architect. But that's my era.
Okay, no, wait a minute. I understand Lego architect, but I don't know that I get Brady Bunch architect.
Oh, Brandon. Mike Brady, the dad on the Brady Bunch, was an architect.
Oh.
A lot of people in my class that I sat next to when I started, they all grew up watching the Brady Bunch, and that was the picture they saw of
Got it.
the drafting board at home, designing houses, and everyone thought they were going to design houses when they were in college. Very few people design houses, as it turns out.
So after watching a lot of Brady Bunch, you decided that you wanted to be an architect. So then why healthcare?
Healthcare, it was a little bit of a happy accident. When I graduated from college, it was a little bit of a downturn. I moved out to Seattle, and I got a temporary job at a hospital doing construction management. And turned out I really enjoyed working with that type of client and on that challenge. And working there, I really got an inside track on how to work with, what the design needs were for all of the different spaces, but also how to work with the different groups within a hospital. And so it really set me up to for my specialty going forward.
In today's episode, we're kind of focusing on, I've heard it called a couple of different things. I've heard it called ACS, alternate care sites. I've heard it called THC, temporary health care, which obviously could cause some confusion, especially in that industry. But essentially, it boils down to the conversion of a facility into healthcare, and in this case, an education facility. Tell me a little bit about that.
Yeah, so this idea came from our education group initially, and they asked us to partner with them, given our expertise in healthcare, to look at the proposition and the value proposition of using schools. And aside from the fact that schools closed, schools have a lot of similarities in terms of the general occupancy from a number standpoint. So you've got a lot of plumbing fixtures, you've got showers, you have food prep facilities, so you've got the cafeteria, you've got some large spaces that you could use to convert for some of these pop-up style tents, and then you also have a lot of medium-sized classrooms that can be used to segregate for different types of healthcare. And the infrastructure, mechanical systems are not the best. That was one of the challenges that we looked at a lot. But in terms of the numbers of people that are accommodated in a school, it really gives you a little bit a more similar occupancy load that makes it work out well for clinics.
So how did you even kind of get started on this idea?
Well, Bob Erickson from the education team, he came to us and asked us to participate. And this is one of the things I love about working at Corgan is, we have specialized sectors that are experts in what they do. We find, especially in healthcare, there's a lot of times we need something from almost every one of Corgan's sectors. And when we do, we can go to them and really get latest and greatest in that market and kind of apply it to the hospital. So, whether it be data centers or education teaching facilities, corporate interiors, administrative spaces, obviously. All of those are contained in a normal hospital campus. And so we really value the partnership, and so that this was just a good example of that.
And what was the goal for this? Because I understand it, you didn't really have a client for this.
We didn't. So it was a little bit of a spec project. We anticipated, and we were looking for the school district and maybe the university Board of Regents to kind of grab the idea and allow us to do a demonstration project with one location. And time, this kind of design on the fly topic here, timing is important when you're trying to deal with a urgent crisis like the COVID-19. And so we needed to do something fast, but we couldn't necessarily get to the people that we needed to make that decision. So early on, we decided to just pursue this as a spec idea rather than an actual demonstration project, and use it as kind of a national thought starter that we would put out that could be used anywhere. Obviously we're located in Arizona, and we're looking at that market, but we're kind of taking that as an example and then extrapolating it for use in other areas. And as we continued on this process, the need in Arizona appeared like it might not get to the point where they would need to develop these alternative care sites outside of the traditional healthcare institutions. So it kind of the initial intent morphed as the project happened, and we quickly realized that you can't make it perfect. You have to kind of decide what are the most important things, and then put something out there that is going to be useful and helpful to the community, for the hospitals and the education community.
It seems like you've kind of got to strike a balance between being thorough and thinking through all the options, but also doing it in such a timely manner that it's still relevant. Tell me a little bit about how you found that balance.
There was a lot of discussion in the team about what's the best alternative site for COVID. What's the best alternative site for non-COVID? That there's kind of two different schools of thought out there. One is let's get segregate those people so that they don't infect others, and then the other is COVID is a really high acuity care and requirement, and it's a lot easier to take care of those patients at a hospital that's already designed for that, and it's a lot easier to set up an alternative site for either a clinic or a low acuity inpatient use. And so
sorry to interrupt, but when you say low acuity, you basically mean things that aren't as serious or that that are outpatient.
Well, or inpatient. So, and that's kind of, in the end, that's what we decided, that really the proposition here was, what is a school best for? I mean, there are a lot of things that make it easy to convert, and they're distributed throughout a city. So, in terms of access to them, it's more of a decentralized resource, and there's a lot of them. So, we thought that there were enough reasons to do it that we didn't want to get hung up on whether it was the best place to do any given particular kind of care. And as you mentioned, we didn't have a client starting out. And so the best thing for us to do in terms of creating this resource is to say, this is great for these reasons. And then here are the things that we feel that we can we can do in a school environment that would relieve pressure from the hospital system and allow them to treat more COVID patients.
So what does that look like? I mean, you mentioned a couple of the things like the air handling, and you make some conversions to an education facility. What does that look like after the pandemic or the need has left?
Well, one thing I love about design, or maybe it's just the creative process because it's not that different in writing. But as you start designing things, different ideas present themselves, based on the medium you're working with. And as we looked at the problem of what do we have to do to convert and what do we have to do to then bring it back, and because we want that to be usable for as long as possible, and then be able to very quickly get it back in shape for school. We realized that there were a lot of things that the schools needed to do from an environmental standpoint and an infrastructure standpoint to be better set up to teach kids in the post, once they go back, having to deal with COVID. And so our team felt that, this would be a great excuse to do some upgrades that you might not want to do otherwise from a cost perspective, because leaving it there in the end, they would be better set up to take care of, to teach in a healthier environment. So schools are classically underfunded. So again, kind of leveraging this crisis and federal funds needed to deal with the healthcare need, if we can also improve the school environment as well.
Yeah, for sure.
It seemed like that would be an easy sell for a lot of agencies.
You're getting a whole lot more value out of that for sure. So obviously, I'm sure depending on whether they do, a high acuity or a low acuity facility and what kind of school it is, there's a variety of, I'm sure, costs and timelines. But did you get a feel for what that range might be in terms of converting it, an educational facility, to a healthcare facility?
Yes. So we did. We had a little bit of trouble coming up with a definitive timeline based on the fact that the schools could really be used for anything from inpatient healthcare, for like a med-surg type of a patient, to outpatient clinics, to a screening facility. And it'd be very quick to convert it to a screening facility or an outpatient clinic. Inpatient care would require a little bit more time to make that conversion. Emergency power is something that you need, and then the HVAC systems are also require greater levels of filtration, and in some cases different pressurization. So the more outpatient the nature of the facility is, the less we would have to do and the quicker it would be.
So is that like weeks?
We felt like that in order for this to be realistic, that we needed to try to get this down to a 3 to 4 week time frame to convert, and for it to make it worthwhile.
Yeah, God, that's actually really quick for something with the magnitude that you're talking about. So one of the other things that you mentioned was, with this process and how it evolved, there wasn't an actual client. Are there challenges in designing without a client?
Yeah, it's a lot easier to design with specific requirements. That's kind of what the client brings. Without a client, you don't know exactly what types of patients they want to care for. You don't know if they have equipment and supplies. You don't know how they're going to staff it, because how you design a facility, knowing how it's being staffed is critical to making sure that it flows appropriately. So without having a client, we really just had to rely on our own um, design knowledge from having worked in, and again, um, looking at the spaces and saying, okay, what does this space want to be? Kind of the Louis Kahn, brick. What does the brick want to be? What does this classroom want to be? Well, it would be a great 4-bed inpatient space, or it would be, a good 8-bay exam area. Some of the pediatric classrooms, they had bathrooms attached to them, whereas the other classrooms didn't. And so, we really just went through space by space and said, okay, here are needs that we foresee might be presented, and then these are the spaces that we would recommend using for that. And so, our healthcare team, we have a variety of people of backgrounds on our team, from prior surgeons, surgical techs, to financial administrators. And so everyone kind of has a little bit of a different take on it, and bringing all those people together on the team, along with the education team as well, is what really allowed us to think out of the box, and then just generate that kind of best use proposition that this study, in the end, that's what the study that's what we produced in the end, was kind of a best use document for using schools as an alternative care site.
So that's something that's publicly available.
Yes. So this study has been published. It's been put out on the Corgan blog, and was also, I believe, published in the ABEX magazine, which is kind of a online commercial real estate website. And we are distributing it to our healthcare and education clients nationwide, to our partners in construction industry as well, just to get this information out, and hopefully allow them to more quickly make the decision, do the analysis, make the decision, and then convert those sites quickly, since we've done a little bit of the legwork thinking through it.
In a quick design situation, you're wrestling with being timely as well as being thorough. Tell me a little bit about that challenge that you faced.
Designing a design sprint, as you've titled this series, this really was a design sprint based on the need. And one of the challenges that we faced was trying to be thorough, but also getting it done quickly enough to be relevant and to be a resource that could be utilized in time. We all know construction takes a long time to realize, and so doing something quickly was important. We'd like to do things right, and so we did struggle with that, and our team felt that in the end, we didn't want perfect to be the enemy of doing something good. And so getting this out, getting it, not having it be 100%, because it really couldn't be 100% for an unknown variation, a quantity of variations out there in terms of need or site, that we would just kind of take a best practice or a best use approach for the schools and have it be a reference document. And in fact, one of the great deliverables that we had in that was this chart of types of spaces that you need for healthcare on one, and the types of spaces that exist in a school on another. And then, just sort of populating that so that very quickly they could use this to analyze their own situation. That's kind of how we got ourselves out of being too worried about having everything be perfect. But, we did try to leverage as many people, experts as possible, from the education team, our team, a mechanical, electrical engineering team, and also cost estimators and logistical construction managers. So just bringing everyone in there, bringing all the ideas together, and then putting that package out. It's not perfect, but we would still be working on it if it had to be. So.
Well, Eric, thank you for joining us and sharing that process with us for this design sprint. For those of you that are either listening or watching, we will put in the description a link to this paper so you can read more about it. And please join us for part 2 of design sprints, where we're going to be talking about actually something a little bit different, not so much a designed space, but a designed item, and the design sprint that went into creating this in only a week. So please join us for that, and thank you for watching The Square.